I'm Dr. Anthony Maloof of Eyes and Faces and Corneal and Oculoplastic Surgery in Sydney, and welcome to this video edition on which sunglasses. Now, patients are always asking about sunglasses, and there are different types. Some of them can actually even have prescriptions in them. The reason we recommend sunglasses are for protection to the eye and the periocular region, which is this whole region. So from skin cancers, to cancer on the surface of the eye, to cataract, to degeneration, a whole range of things, to pterygium. They're particularly important after pterygium surgery, where the side lighting is a huge factor in whether you develop a recurrence. So here's the problem. Sunglasses are a fashion statement. They basically form before function. Ultimately, if you want your surgery to work and you want to protect against disease, you've got to put function ahead of form. That's not something the sunglasses industry is really that interested in, but you are if you're interested in your health and your eye health. So, function first. What do I mean by function? I mean stopping excess intense UV light getting in. How much UV light? Tremendous amount. So you need to have some protection. We need something that's wraparound. There are some very boxy wraparound sunglasses, cancer sunglasses that are available, and yes, they function, but they're not that great. Patients often ask me about what material. Well, I remember in my Masters of Engineering degree, we tested all different types of material, and the cheaper stuff filtered the light out just as good as the very expensive stuff. In the end, wraparounds is what you need. And so I've got a set of wraparound sunglasses here. The company that makes them is called Ugly Fish. I have zero connection with that company and no funds. I use these because they're on the cheaper side. They do the job beautifully, and they're actually a very good example of a wraparound sunglasses. So you can see a broad rim on the side, put them on and they conform to your skull and they cover the sides and the front. The lenses are actually very good. They're polarized. These are more tuned for if you're a fisherman out in the water. You can get different colors as well. But the polarizing does work to reduce the amount of UV, but it also is important for glare as much as UV. But something like this is a reasonably priced pair. You can get more expensive pair, but that is it. You won't see it in the fashion houses, but that's what a protective sunglasses that's what an ideal shape for protective sunglasses is. Everyone's face is different, so make sure they conform well. And really, there's no point they're in a case. You've got to wear them outdoors. So I have these different versions, but of these when I'm outdoors, and literally, yes, you look like Terminator. Be very careful when you have to wear a face mask because you are covered up, but from an eye protection point of view, this is the ultimate at present. So I hope that all makes sense. I'm Dr. Anthony Maloof of Eyes and Faces and Corneal and Oculoplastic Surgery in Sydney, and thanks for watching.